Spleen pattern etiology of spleen patterns. 1. Mental factors. Excessive thinking, studying, concentrating, brooding, obsessing, etc. weakens spleen. 2. Diet. Spleen likes foods that are warm, in energy and temperature, example, meat, pepper, ginger, orange peel, kumquat, and dry foods. Excessive consumption of cold foods, in temperature and energy, will impair spleen function of transformation/transportation and cause interior dampness and digestive problems. In addition, eating in a hurry, when stressed or upset, skipping meals and eating poor quality food all significantly weaken spleen qi. 3. Exogenous pathogens. Spleen hates dampness, can be invaded by exogenous dampness. Dampness can invade when people live in damp places, remain in wet clothes after running or swimming, wade in water or work in watery areas. Women are very prone to invasion of exogenous dampness during menstruation and after childbirth. Exterior dampness can combine with heat or cold. Patterns. Signs. Pulse and tongue. Etiology and pathology treatment principal points: spleen qi deficiency. No appetite. Abdominal distension after eating. Fatigue, lassitude, weakness of limbs. Sallow complexion. Loose stools. Tongue, pale or normal. Chronic, swollen sides in the middle section only of the tongue. Very severe cases have swollen sides with transverse cracks. Coating, thin, white sticky, greasy. Pulse, empty. 1. Diet. Excessive cold and raw foods deplete the spleen qi. Irregular or excessive eating too little in general or not enough protein. 2. Mental strain. Excessive thinking over long time, common in students and business people. Especially bad if discuss work over lunch or hurry lunch and rush back to work. 3. Climate. Prolonged exposure to damp weather or damp house weakens spleen. 4. Chronic disease tends to weaken spleen, which is the root of postnatal jing and is hence overworked trying to restore health. Tanifa spleen qi. Ren 12. ST36, SP3. SP6. BL20, BL21. Deficient spleen qi leads to internal dampness, nausea, stuffiness of chest and epigastrium, feeling of heaviness in head and limbs, head in a bag. Tongue, pale or normal. Chronic, swollen sides in the middle section only of the tongue. Very severe cases have swollen sides with transverse cracks. Coating, thin, white sticky, greasy. Pulse, empty. 1. Diet. Excessive cold and raw foods deplete the spleen qi. Irregular or excessive eating too little in general or not enough protein. 2. Mental strain. Excessive thinking over long time, common in students and business people. Especially bad if discuss work over lunch or hurry lunch and rush back to work. 3. Climate. Prolonged exposure to damp weather or damp house weakens spleen. 4. Chronic disease. Tends to weaken spleen, which is the root of postnatal jing and is hence overworked trying to restore health. Spleen yang deficiency. Lack of appetite. Abdominal distension after eating. Fatigue. Bright white or sallow complexion. Weakness of the forelimbs. Loose stools. Often with undigested food. Chillness, cold limbs. Edema. Tongue, pale, swollen, wet. Pulse, weak, slow, deep. As for spleen qi deficiency, or from overeating of cold and raw foods, or exposure to cold and damp environment. Pathology, similar pattern to spleen qi deficiency but has symptoms of cold because spleen yang fails to warm the body. Tanifi and warm spleen yang. SP9, Ren 9, ST28, BL22. Spleen qi sinking. Signs of spleen qi deficiency. No appetite, abdominal distension after eating, fatigue, lassitude, weakness of limbs. Sallow complexion, loose stools, plus, prolapse, of uterus, anus, stomach, vagina, heavy sensation in abdomen, of bearing down, frequent or urgent urination, hemorrhoids, varicose veins. Tongue, pale. Pulse, empty or weak. As for spleen Qi deficiency, but even more likely in those who have spleen Qi deficiency and who also stand for a long time every day. Tanifa spleen Qi and raised Qi. Ren 12. ST 36. SP3. SP6. BL 20, BL 21. Do 20. Ren 6. ST 21. Do 1. Spleen unable to control blood. Spleen Qi deficiency, no appetite, abdominal distension after eating, fatigue, lassitude, weakness of limbs. Sallow complexion, loose stools, plus signs of bleeding. Tongue, pale. Pulse, fine. Spleen function of keeping blood in the vessels is impaired, therefore bleeding occurs. Bleeding is of deficiency kind rather than the excess type of bleeding that occurs when there is heat in the blood. Same as for spleen Qi deficiency. Tanifa spleen Qi. Ren 12. ST 36. SP3. SP6. BL 20, BL 21. SP 10. BL 17. SP 1. Damp cold invading the spleen. No appetite, stuffy chest and epigastrium, cold feeling in epigastrium improved by warmth. Heavy feeling in head, heavy limbs, lethargy, no taste or sweetish taste in mouth, no thirst. Thin stools. Turbid secretions or excretions, white vaginal discharge, diarrhea. Stickiness of eyes and fluid-filled skin, eruptions. Maybe retention or dribbling urine and edema. Tongue, pale with thick sticky white coating. Pulse, slippery, slow. Pathology, cold or damp will predominate. 1. If cold predominates, this pattern is commonly associated with the pattern of retention of fluid in stomach due to cold and with deficient spleen yang. 2. If dampness predominates, it can be internal or external. External dampness is usually acute and of more sudden onset. It can be caused by too much cold or raw food and drink as well as by damp climatological factors. Internal dampness gradually accumulates from deficiency of spleen Qi and spleen Yang being unable to transform or transport fluids. This is a deficiency pattern turning into excess. Etiology or pathology, exposure to external dampness, cold raw food, drink or climate, etc., or from deficient spleen Qi or deficient spleen Yang. Resolve dampness. SP9. SP6. Ren 12. SP3. ST8. Damp heat invading the spleen. No appetite. Feeling of heaviness. Stuffiness or distension of epigastrium and lower abdomen. Thirst without desire to drink or desire to drink small sips. Nausea, vomiting. Abdominal pain. Loose stool with offensive odor. Burning sensation of anus. Scanty, dark yellow urine. Low-grade fever. Headache. Tongue, sticky yellow coating, maybe slightly red body. Pulse, slippery, rapid. 1. Subdivided into predominance of damp or of heat. A. Damp. Predominating, no thirst or thirst without desire to drink, not particularly rapid pulse, not very red tongue body. B. Heat predominating, thirst, rapid pulse, red tongue body. 2. Subdivided into external damp heat or internal damp heat. A. External damp heat, usually acute and of sudden onset, arises from exposure to hot, humid climate or from contaminated food. B. Internal damp heat, usual chronic, gradual onset, arises from excess consumption of greasy foods and alcohol etc. over long time. 3. Subdivided into whether bile flow obstructed or not. A. Bile flow obstructed, signs are similar to damp heat in liver and gallbladder, i.e. jaundice, bitter taste in mouth. As for the latter, common disease patterns would include hepatitis, cholecystitis and cirrhosis. In general, signs are of dampness accumulating and obstructing the flow of Qi, example. Signs of heaviness, distension and scanty urination. Damp depresses spleen function, producing lack of appetite and lethargy. Heat signs include low fever, thirst, but without desire to drink much, because of presence of dampness. Resolve dampness, clear heat. SP9. SP6. Do9. Li11. BL20. GB34. Small intestine. Etiology of small intestine patterns. The small intestine relies on spleen yang for transformation of food, and uses kidney yang in its transformation of fluids. Because of this, several patterns of the small intestine are linked to spleen or kidney yang deficiency. Diet and nutrition. Excess cold and raw food can cause cold to accumulate in the small intestine. Excess hot and spicy foods can cause heat to accumulate. Emotions. The small intestine is indirectly affected by emotions such as anger that cause liver qi to stagnate. Patterns. Signs. Pulse and tongue. Etiology and pathology. Treatment principle. Points. Excess heat in the small intestine, heart fire transmits to small intestine. Abdominal pain, small intestine fire. Tongue ulcers, heart fire rising to tongue. Scanty, dark, painful, or bloody urination. Scorched fluids. Insomnia, mental restlessness, throat pain, thirst, heart fire. Sudden hearing loss. Fire affecting small intestine channel. Red with a swollen red tip and a yellow coat. This is interior excess heat. Heart fire is transmitted to the small intestine, the yang organ related to the heart. Emotional problems such as anxiety and excessive stress can predispose a person to this pattern. Clear heart and small intestine fire. SI2. SI5. HT5. HT8. ST39. Small intestine qi stagnation. Twisting pain in the lower abdomen that may radiate to the lower back, distension. Qi stagnation. Pain is worse with pressure. Excess in nature. Borborygmus, flatulence. Flatulence relieves pain, intestinal qi stagnation. Testicular pain, qi stagnates along channel, from liver qi stagnation. Tongue. White coating pulse. Deep and wiry pulse. Any of the causes of stagnation of liver qi may lead to this syndrome. It may be acute, excess condition, or chronic, such as deficiency of spleen qi with liver qi stagnation. Excess cold and raw food which impair the small intestine's transformation function. Harmonize liver, move qi in lower burner. Ren 6. GB34. Liv 3. Liv 13. ST27. ST29. SP6. ST39. Small intestine qi obstruction. Violent abdominal pain that is worse with pressure, constipation, stagnation, and obstruction in the small intestine. Vomiting, borborygmus, flatulence. Descending function of stomach qi is impaired. Tongue. Thick white coating pulse. Deep and wiry pulse. This is similar to small intestine qi stagnation, but is always acute in nature. It is commonly caused by overconsumption of raw and cold foods which impair the small intestine's transformation function. While this pattern resembles appendicitis, it can occur without the presence of appendicitis. Remove obstruction from lower burner, move qi of small intestine. ST39. Lanwiexio. Ren 6. GB34. ST25. SP6. Liv 3. Small intestine deficiency and cold. Subcategory of spleen yang deficiency. Abdominal pain, relieved by warm and pressure cold obstructing intestines. Borborygmus. Small intestine involvement. Diarrhea. Spleen yang weak. Pale and copious urination, desire for warm liquids. Yang deficiency. Tongue. Pale with a white coat pulse. Deep, slow, and weak pulse. Excess consumption of cold and raw food. Warm and tonifa small intestine and spleen, disperse interior cold. Ren 6. ST36. ST25. ST39. BL20. BL27. Heart pattern. Etiology of heart patterns. Emotions affecting the heart. While sadness relates to the lungs in 5-element theory, sadness affects the heart chi because the heart and lungs are closely related and mutually assist each other. Sadness weakens lung chi, which can cause heart chi to become deficient. Prolonged sadness and deficient chi can also lead to stagnation of chi, which can lead to heart fire. While anger affects the liver directly, it affects the heart indirectly. Anger causes liver yang to rise, which can eventually be transmitted to the heart, causing heart fire. Blood loss or severe bleeding affecting the heart. Severe blood loss from hemorrhage or long-term illness can deplete heart blood, heart rules blood, and this can lead to heart chi deficiency. Patterns. Signs. Pulse and tongue. Etiology and pathology. Treatment principle. Points. Heart chi deficiency. Palpitations, key sign. Due to heart chi deficiency. Fatigue, shortness of breath, spontaneous sweating, pale face. Due to chi deficiency. Tongue, normal color, pale color in severe cases. Midline crack to tip with swollen sides in severe cases of heart chi deficiency. Pulse, empty. Due to chi deficiency. Tonifi heart chi. HT5. P6. BL15. Ren 17. Ren 6. Heart yang deficiency. Palpitations, shortness of breath on exertion, fatigue, sweating. Heart chi deficiency. Discomfort in the chest and heart region. Heart yang failing to move chi in the chest. Sensation of cold, cold limbs and hands, bright pale face. Yang deficiency, cold signs. Tongue. Pale, wet, and swollen tongue due to yang deficiency. Pulse. Deep and weak pulse. Yang deficiency. Knotted in severe cases. Heart yang not properly. Moving blood. Because the kidneys are the source of yang for all the internal organs, chronic kidney yang deficiency can lead to heart yang deficiency. Tonifi and warm heart yang. HT5. P6. BL15. Ren 17. Ren 6. Du 14. Heart blood deficiency. Palpitations, more pronounced in the evening. Due to the heart blood deficiency affecting heart chi. Insomnia, poor memory, anxiety, dream disturbed sleep, easily startled due to the heart not properly housing the shen. Dull pale complexion, pale lips, dizziness. Due to blood deficiency. Tongue. Pale and slightly dry. Due to blood deficiency. Pulse. Choppy or fine pulse. Due to blood deficiency. 1. Spleen chi deficiency. Dietary insufficiencies, overthinking, can cause blood deficiency and then heart blood deficient. Therefore, heart blood deficiency is often associated with spleen chi deficiency. 2. Chronic worry and anxiety disturbs the shen, which depresses the heart function and leads to heart blood deficiency. 3. Severe hemorrhage, in childbirth, or any cause of deficient blood. Tonifa the blood and heart, soothe the shen. HT7. P6. Ren 14. Ren 15. Ren 4. BL17. BL20. Heart yin deficiency. Palpitations. Heart yin deficiency affecting heart chi. Insomnia, wakes often, mental restlessness, easily startled, poor memory, anxiety. Heart blood deficiency. Sensation of heat that is pronounced in the evening, low-grade fever, malar flush, night sweats and 5-palm heat, dry mouth and throat. Heart yin deficiency. Tongue red with no coat, possible red tip or red points. Pulse fine and rapid or floating empty and rapid. Chronic anxiety, worry, and a busy lifestyle can Damage yin and cause yin deficiency. Tonify and nourish heart yin. Nourish kidney yin. Calm the shen. HT7. P6. Ren 14. Ren 15. Ren 4. HT6. SP6. Key 7. Key 6. Heart fire blazing. Palpitations. Mouth and tongue ulcers. Heart heat affecting the heart. Mental restlessness, agitation, impulsiveness, insomnia, and dream-disturbed sleep. Heat disturbing the shen. Blood in the urine or dark urine. Heart fire moving to the small intestine. Bitter taste in the mouth. Heart opens to the tongue. Thirst and a sensation of heat. General heat signs. Tongue. Red with a very red tip. Heart area. Swollen with red points. Yellow coat with a possible midline crack. Pulse. Rapid and full, especially in the heart position. Possibly irregular. 1. Emotional problems. Example: chronic anxiety, constant worrying and depression can lead to heart fire. Over a long time, these emotions can lead to stagnation of qi, which leads to fire. Especially, when qi stagnation is associated with mental depression, it can turn into fire and produce heart fire blazing. Often patients with chronic depression will show signs of this pattern, although they may appear subdued. 2. Heart fire is often transmitted from liver fire. Therefore, any of the causes of liver fire, anger, resentment, and frustration, can cause heart fire. Clear the heart and soothe the shen. HT9. HT8. HT7. Ren 15. SP6. Key 6. Heart blood stagnation. Palpitations. Heart qi involved. Pain in the chest and heart region, which may radiate down inner left arm. Due to blood stagnation in the chest. Oppression, constriction, or discomfort in the chest. Due to blood stagnation in the chest. Cyanosis of lips and nails, cold hands. Tongue. Purple tongue. Pulse. Knotted pulse. Emotional problems, especially anxiety, grief, resentment, or repressed anger over a long periods, cause blood stagnation in the chest. Unexpressed emotions tend to be held in the chest and interfere with the circulation of qi and blood. Regulate blood, remove stasis, tonify and warm heart yang. Or sedate heart fire or tonify heart blood, calm the shen. P6. P4. HT7. Ren 17. BL 14. BL 17. SP 10. Key 25. Sanjiao pattern. Patterns of the Sanjiao. The Sanjiao, triple burner, is not viewed as an organ distinct from other Zhangfu organs and therefore has no actual patterns. Patterns of the Sanjiao are recognized by the same patterns that affect the organs contained therein. Patterns associated with the areas of the Sanjiao. Patterns of the lung and heart are the patterns of the upper jiao, burner. Patterns of the spleen and stomach are those of the middle jiao, burner. Patterns of the lower jiao, burner, are those of the kidney, bladder, small and large intestines. Particular patterns or disharmonies are more easily associated with the functions of the Sanjiao. Upper jiao, burner. The upper burner disperses and vaporizes the body fluids of the upper body. This function falls under the scope of the lung dispersing function. For this reason the upper jiao is compared to a mist. In a disease state the function of dispersion is blocked usually by an exogenous pathogen, wind cold or wind heat, defensive qi circulation is impaired and the pore are blocked. This results in the manifestations occurring in invasion of the lungs by wind cold or wind heat. When the Sanjiao is attacked directly, usually by wind heat rather than wind cold, there will be deafness, lateral canthus pain, earache, mastoid pain, edema of the cheeks and throat soreness. Curiously, the tongue will typically have an abnormal coating, yellow or white, on one side only. Children frequently have red points on only one side of the tongue. Middle jiao, burner. The middle jiao digests food and drink, rotting and ripening. Its function is compared to the stomach. Disorders of the middle jiao are usually characterized by accumulation/stagnation of food in the stomach. Lower jiao, burner. The lower jiao transforms, separates and excretes fluids and is said to be the drainage ditch. Its functions are those of the bladder, kidney, small and large intestines. In disease, the lower jiao gives rise to symptoms of damp heat or deficient and cold bladder, kidney yang deficiency or damp heat in the small intestine, all of which result in dysfunction of micturition or defecation. Diagnosis of combined patterns in Chinese medicine. Patterns. Signs. Pulse and tongue. Etiology/pathology. Treatment principle. Points. Liver invading the spleen. Alternating diarrhea and constipation. Due to the liver invading the spleen, or the qi of the spleen being too weak to withstand the energy of the liver. Sloppy, loose, or small pebble-like stools due to the liver qi stagnating in the intestines and then invading the spleen. Abdominal distension and pain due to liver qi stagnating in the abdomen. Fatigue due to deficient spleen qi. Long-term emotional problems cause liver qi to stagnate, which will eventually invade the spleen. Other attributing factors include overwork and irregular diet, which cause spleen qi to become deficient. Liver is responsible for smooth flow of qi throughout the entire body. When qi stagnates in the abdomen, it disturbs the spleen's function of transformation and transportation. Harmonize liver and tonife spleen. Liv 14. Liv 13. GB 34. Liv 3. Ren 6. Ren 12. ST 36. SP 6. Liver invading the stomach. Irritability, distension, and pain in epigastrium and hypochondrium. Due to liver qi stagnation. Fullness in the epigastrium. Due to the stomach's rotting and ripening function being impaired. Sour regurgitation, belching, nausea, vomiting. Due to rebellious stomach qi. Pulse, weak stomach pulse, middle right, wiry liver pulse, middle left. Emotional problems over long time causing liver qi to stagnate, plus irregular diet and overwork, weakening stomach qi. Stagnation of liver qi invades stomach and interferes with stomach qi descending. Stomach qi then rebels upward causing belching, nausea and vomiting. Stomach cannot rot and ripen food, hence fullness in epigastrium and sour regurgitation. Stagnation of liver qi causes distension, pain, irritability. Tongue varies according to whether the stagnation predominates or the deficient stomach qi predominates. General, harmonize liver and tonife stomach. Acupuncture, sedate points that harmonize the liver. Tonife points that tonife stomach. Liv 14. Liv 13. GB 34. Ren 13. Ren 10. ST 36. BL 21. Liver fire injuring the lungs. Breathlessness, asthma, cough. Liver fire prevents the downward movement of lung qi. Blood streak sputum. Liver fire rises to injure the vessels. Fullness in the hypochondrium, stuffiness in the chest due to liver qi stagnation. Headache, dizziness, red face, bitter taste, thirst due to rising liver fire. Scanty and dark urine, constipation due to heat. Tongue, red, redder on sides, swollen in front, yellow coat. Pulse, wiry and slippery. The liver controls the smooth flow of qi. This influences the descending function of the lungs. When liver qi stagnates over long period of time, it gives rise to liver fire, which rebels upwards toward chest, causes hypochondriac fullness, stuffiness in the chest, and prevents the lung qi from descending. Rising liver fire can also create headache, dizziness, red face, thirst, bitter taste, scanty dark urine, constipation, blood-tinged sputum, and deep red tongue color on sides, all which are excess heat signs. In 5 elements, this is wood insults metal etiology, anger and repressed emotions cause liver qi to stagnate. After a long period of time, liver qi stagnation turns into liver fire. This is worsened by excessive consumption of hot and greasy foods, these create heat. Clear liver fire, harmonize liver qi, descend lung qi. Liv 2. Liv 14. Ren 17. Ren 22. Pe 6. Lu 7. Li 11. Spleen and lung deficiency. No appetite. Spleen qi deficiency. Fatigue. Qi deficiency. Slight shortness of breath. Lung qi deficiency. Loose stools. Spleen qi fails to transform digstate. Weak voice. Lung qi deficiency. Bright white complexion. Qi deficiency. Slight spontaneous perspiration. Lung qi deficiency, wei qi fails to control perspiration. Tongue, pale. Pulse, empty, especially on the right. The spleen and lungs are both vital to qi production and mutually influence each other. It is said, the spleen is the source of qi, and the lungs are the pivot of qi. Poor diet, such as excess cold food or drink, may weaken spleen, which may fail to send enough food qi to lungs. Poor breathing, lack of exercise, bending over desks and impairing movement in chest weaken lung qi, which may then result in a lack of production of zhen qi, also called true qi, yin, and wei qi. Tanifa lung and spleen qi. ST36. SP3. BL20. BL21. LU9. BL13. DU12. Spleen and liver blood deficiency. Dizziness. Tiredness and fatigue. Sallow complexion. Blurred vision. Numbness and tingling of the limbs. Tongue, pale with paler sides, orange sides in severe cases. Pulse, choppy. Pathology. Food qi produced by spleen is the basis for formation of blood. When the spleen qi is deficient, not enough blood is produced. The liver stores the blood, so deficient blood results in lack of blood in liver, hence the dizziness, numbness, and pale or orange color of the sides of the tongue. Etiology and pathology, usually due to poor diet, lack of nourishment, or excessive cold and raw foods. Tanifa spleen qi, nourish blood, Tanifa liver blood. ST36. SP3. BL20. BL21. Liv 8. BL18. BL17. SP6. Spleen dampness with liver stagnation. Stuffiness/fullness of epigastrium. Due to damp obstruction. Nausea, poor appetite. Due to dampness obstructing the descending stomach qi. Loose stools. Due to dampness obstructing the spleen's function. Feeling of heaviness. Due to dampness obstructing the spleen's function. Thirst for small amounts of liquid due to dampness. Sallow complexion. Hypochondriac pain due to liver qi stagnation. Jaundice due to dampness and stagnation impairing bile flow. Bitter taste due to qi stagnation and heat. Tongue, thick, sticky, yellow coat. Pulse, wiry and slippery. Deficient spleen fails to transform or transport fluids, which accumulate to form dampness. Dampness obstructs qi flow in middle burner and interferes with qi flow. Spleen qi should ascend and stomach qi should descend, and smooth flow of liver qi in middle burner. Eventually, obstruction of dampness turns into heat. Dampness obstructs the smooth flow of liver qi and bile. Liver qi stagnates in middle burner and gallbladder cannot secrete bile. Overconsumption of greasy foods that cause dampness in spleen plus any of the causes of liver qi stagnation, emotions. Tanifa spleen, resolve damp, promote smooth flow of liver qi. Ren 12. BL20. SP6. SP3. Liv 13. Liv 14. GB 24. GB 34. Turbid phlegm affecting the head. Severe dizziness. Phlegm is more formed than dampness, so rather than just having a feeling of heaviness in the head, there is severe dizziness. Heavy limbs, numbness, clumsy movement. Phlegm interfering with the flow of qi. Congested feeling in the chest, palpitations, phlegm obstruction the chest. Nausea and vomiting. Phlegm impairs the stomach's descending function. Tongue. Thick greasy coat. Pulse. Slippery. This pattern develops from spleen dampness. It is often associated with hypertension due to obstruction by phlegm and dampness. Transform phlegm, open chest, pacify stomach. P6. ST40. SP9. If accompanied by hypertension, Li11, ST36. GB20. Liv3. Differentiation of syndromes according to the 6 stages. Differentiation of syndromes according to the 6 channels originally appeared in the traditional Chinese medicine classic called the Shanghan Lun, which can be loosely translated as uncold damage. It was written by Zhang Zhongjing in the late Han Dynasty, circa 20 to 200 AD. The original text was then divided into 2 texts, one being the Shanghan Lun, which focused on external conditions, and the other being the Jinghui Yao Lu, which focuses on internal conditions. Many of the herbal formulas from these 2 texts are not only very elegant, but still useful today. Tai Yang, initial Yang, syndromes. Tai Yang Zhongfeng syndrome. Febrile disease caused by wind, external deficiency. Tai Yang Shanghan syndrome. Febrile disease caused by cold, external excess. Yang Ming, Greater Yang, syndromes. Yang Ming Jing, channel, syndrome. Yang Ming Fu, organ, syndrome. Xiao Yang, Lesser Yang, syndrome. Tai Yin, initial Yin, syndrome. Xiao Yin, Lesser Yin, syndrome. Yang deficient Xiao Yin syndrome. Yin deficient Xiao Yin syndrome. Ju Yin, Greater Yin, syndrome. Tai Yang, initial Yang, syndromes. The Tai Yang syndrome corresponds to the initial invasion of the external cold evil through the pores and interstices of the skin. General symptoms: headache and stiff neck, chills and fever, floating pulse. The stiff neck and headache will be located in the Tai Yang, bladder and small intestine channel, areas of the body. The floating, superficial, pulse is located in the exterior, and with the finger raised, it has a surplus. When pressing down it is insufficient, weak, or disappears. When pressure is released, it regains full strength. A fever ensues when the strong zhang, upright, qi of the body engages the wind-cold invasion, cold evil, at the surface level of the body. Tai Yang syndrome fevers are relatively mild because the invading cold is weak compared to the body's wei, defensive, qi, as it is in the initial stage of entering the body. If the cold evil becomes stronger because the wei, defensive, qi is weak or easily depleted, the fever will increase as the pathogen penetrates deeper into the Yang Ming or Xiao Yang channels. The Tai Yang fever is generally accompanied by chills, at least in the initial stages of the invasion. Nasal discharge and sneezing are not included in the general symptoms for the Tai Yang syndrome. A Tai Yang Zhongfeng syndrome. Febrile disease caused by wind. External deficiency. Symptoms: fever. From wei, defensive, qi fighting with the evil qi. Easily perspires. From the inability of the body to keep the pores closed due of lung qi deficiency. Also the body's attempt to relieve the fever and heat. Headache. Cold type of headache with muscle tension around the neck. Chills. Aversion to wind. Tongue. The tongue body appears deficient, perhaps pale, and the coating is normal, thin, white. Pulse. Moderate floating, superficial, pulse. The pulse is moderate, as opposed to strong. As this is a deficiency condition, the patient perspires easily. Consequently the pulse is not as rapid, as in an excess condition. Shen, spirit. The patient may appear tired and weak. Treatment. Formula: Goiji Tang. Cinnamon twig decoction. Function: releases the pathogenic influences from the muscle layer and harmonizes the nutritive, yin, and defensive, wei, qi. B. Tai Yang Shanghan syndrome. Febrile disease caused by cold, external excess. Symptoms: fever and chills with aversion to cold. No perspiration. As this is an excess condition, the pores are closed and the skin is dry and tight. Headache. In the Tai Yang channel area, occipital region. Lumbago. Arthralgia. General aching. Tongue, normal body with thin white coating. Pulse, floating and tight pulse. Treatment. Formula: Ma Huang Tang, ephedra decoction. Function: releases the exterior cold and arrests wheezing. Opens the lung qi and induces sweating. Acupuncture points, appropriate for both external deficiency and external excess syndromes, Zhou Yangming, Greater Yang, syndromes. As the pathogenic factor invades the interior of the body in the Yangming stage, both the Zheng, upright, qi and the evil, xie, qi are strong, turning the excess pathogen into heat within the body. Yangming fevers are therefore more severe than fevers in the Tai Yang stage. In the Yangming syndrome, there are no chills. There are two types of Yangming syndromes, one that involves the channel, and the other involves the related Zhangfu, stomach and large intestine organs. Both of these syndromes can occur at the same time. A Yangming Jing, channel, syndrome. Symptoms: the four bigs. Big fever. This indicates interior excess heat. This may be accompanied by mental restlessness or irritability if the heat affects the mind. Big sweat. Interior excess heat is evaporating fluids or forcing fluids out. Big thirst. From consumption of body fluids and excess heat. A preference for cold drinks. Big pulse. Strong pathogenic and antipathogenic factors. Red face. No aversion to cold. Tongue, red body with thick yellow coat, or dry coating. Pulse, excess pulse. Treatment. Formula: Bai Hu Tang, white tiger decoction. Function: clears qi stage and Yangming channel heat, drains stomach fire, generates body fluids and alleviates thirst. B. Yangming Fu, organ, syndrome. Symptoms: the four bigs, as above. Constant fever, but more pronounced in the afternoon. Abdominal distension. The Yangming Fu, organ, syndrome will also have abdominal bloating or, in more severe cases, abdominal masses. This is due to the heat drying the fluids, causing qi stagnation in the organs. Constipation. The main distinguishing symptom of the organ, Fu, and channel, Jing, syndrome. Due to interior heat consuming fluids. Tongue, thick, dry, yellow coat. Pulse, excess pulse. Treatment. Formula: De Cheng Qi Tang, major order the qi decoction. Function: vigorously purges the heat accumulation, induces defecation. Xiao Yang, lesser Yang, syndrome. The Tai Yang stage involves evil pathogens, cold, wind, on the exterior of the body which need to be released or sweated out. The Yangming stage involves pathogenic heat in the interior which need to be purged through the bowels. In between these two stages is the Xiaoyang syndrome, where the pathogen is between internal and external. Although the Xiaoyang symptoms include both chills and fever, these symptoms alternate from one to the other. The related channels of the Xiaoyang syndrome are the Sanxiao, gallbladder, pericardium, and liver. Symptoms: alternating chills and fever. It was believed that fevers corresponded to the body's zheng, upright or good, qi fighting and winning against the pathogenic evil qi, and that chills indicated that the body's zheng qi was losing the fight against the pathogenic evil qi. Bitter taste in mouth. Indicates an excess gallbladder condition, heat disrupting the flow of bile. Blurred vision. The liver, which opens to the eyes, is affected. Nausea, vomiting, bloating, poor appetite, and stomachache. An excess liver condition can easily attack, the spleen and stomach, which govern the digestive system. Pain in the costal, hypochondriac, Region. The costal region is the region of the liver, so as the meridian flow is disturbed, so is this area. Irritability, heart vexation, and irregular heartbeat. This corresponds to the pericardium channel being affected. The pericardium is closely related to the heart, which controls the Shen, mind. As the heat disturbs the pericardium, the heart, and thus the mind is also affected, producing irritability, or even insomnia. Tongue. Sides of the tongue are more red, mixed yellow and white coating, again reflecting the halfway characteristic of the Xiaoyang syndrome. Pulse, wiry pulse. Treatment. Formula, Xiao Chai Hu Tang, minor buplurum decoction. Function, harmonizes and releases Xiaoyang, lesser yang, channel disorders. Tai yin, initial yin, syndrome. The invasion into the Tai yin can occur from a chronic Tai yang syndrome progressing into the Tai yin, inappropriate treatment of a Tai yang disease which forces it into the Tai yin, or if the pathogen is strong enough, it can bypass the exterior and immediately invade the Tai yin stage. Food poisoning, for example, can cause sudden diarrhea and cold damp in the body, symptoms of Tai yin syndrome. In all cases, the spleen and stomach zangfu will be deficient and there will be internal cold and dampness present. Symptoms, abdominal fullness. From the spleen not being able to transform and transport. Abdominal pain. As this is a deficient pain, it will be alleviated by warmth and pressure. Diarrhea, nausea, vomiting. Dampness affects nausea and diarrhea. Also, due to the dampness, the stomach qi may be obstructed from descending and may rebel, producing vomiting. No thirst. No interior heat. Tongue, pale with a white sticky coat. Pulse, slow and weak pulse. Shen or spirit, low energy, fatigued. Treatment. Formula, Li Zhongyuan, regulate the middle pill. Function, warms the middle jiao and strengthens the spleen and stomach. Note, comparison of Tai yin and Yangming abdominal pain. In Tai yin syndromes, the diarrhea and lack of thirst are both a product of cold damp inside the body. In Yangming syndromes, the constipation and strong thirst are both products of the internal heat. In the Yangming syndrome, the abdominal pain is aggravated by pressure and heat because it is an excess condition. In the Tai yin syndrome, the abdominal pain is alleviated by pressure and heat because it is a deficiency syndrome. Starting with a common cold, Tai yang syndrome, invasions can progress into more complicated internal or external Xiaoyang conditions, as well as expressing into full heat conditions as the body mounts all its defenses against the invading cold. If the pathogenic factor is too strong, the fever will subside, and this is an ominous sign, accompanied by cold digestive problems, that the situation is getting worse. This is already a serious situation. If allowed to progress further, the condition may be life-threatening. Xiaoyin, lesser yin, syndromes. Xiaoyin syndrome affects the kidneys and the heart. There are two types of Xiaoyin syndromes, one involves a deficiency of yang qi and cold, and the other involves a deficiency of yin and heat. Both involve a serious disruption of the body's basic yin and yang balance. A yang deficient Xiaoyin syndrome. Symptoms, aversion to cold, cold limbs. The Xiaoyin feeling of cold is colder than that of the Tai yin syndrome. The patient may like curled up or prefer many blankets. There is little thirst and the patient may prefer warm drinks. Tendency to sleep and listlessness. From yang deficiency. Diarrhea with undigested food. Cold affecting the spleen and kidney. Clear urine with increased volume. Yang deficiency leading to excess yin. No fever. Tongue, pale, very deficient, with a thin white coat. Pulse, deep, minute, very weak, pulse. Treatment. Formula, Sini Tang, frigid extremities decoction. Function, rescues devastated yang, warms the middle jiao, and stops the diarrhea. Yin deficient Xiaoyin syndrome. Symptoms, insomnia, irritability. From fire flaring up from deficiency. The yin is deficient, so the yang cannot be subdued at night. Dry mouth and throat. Yin deficiency implies deficiency of body fluids producing dry mouth and throat, or even skin and eyes. Scanty dark yellow urination. From consumption of yin from heat. No desire to drink fluids. Tongue, dark red body, red tip with little or no coating. Pulse, thin and rapid pulse. Treatment. Formula, Huanglian E Jiaotang, Coptis and Ashide gelatine decoction. Function, nourishes the yin, causes the deficient fire to descend, eliminates irritability and calms the shen, spirit. Ju yin, greater yin, syndrome. Ju yin is the last yin stage. Starting with the initial Tai Yang stage, we progress through the stages until the Ju yin stage. This syndrome is the last stage of disease caused by cold evil. Its chief attribute is the weakness of the Zheng Qi. Symptoms, alternating sensations of cold and heat. Appetite and thirst. The patient will have hunger but will not be able to eat. Once the food is ingested, the patient will vomit it up. If a purgative is inappropriately prescribed, there will be continuous diarrhea. Frequent urination. Uncomfortable sensation as if air were ascending upwards from below the epigastrium or hot and painful feeling in the chest. This sensation is described as yang separating from yin. Roundworms. The Shanghanlun also describes this condition where parasites, roundworms, may be vomited. Tongue, red papillae with slippery and white coat. Pulse, deep, hidden, wiry. Treatment. Formula, Wu Mei Wan, Mum pill. Function, warms the organs, intestines, calms worms, and stops chronic diarrhea. At this stage of disease, the patient may be in shock. The yang qi needs to be revitalized or the patient may die. Roundworms may migrate to another part of the GI tract that is more suitable if the gastrointestinal tract environment is altered from illness. They may move into and lodge themselves in the hepatopancreatic ampulla, producing extreme colicky pain. In this situation, the ingestion of a sour solution such as vinegar or Wu Mei Wan, may alleviate the pain. Differentiation of syndromes according to the 4 levels. Wei, defensive, level, stage. Qi level, stage. Ying, nutritive, level, stage. Shui, blood, level, cold. Wei, defensive, level. The Wei stage is typically the initial stage of many infectious diseases, or warm wind diseases. The warm evil in combination with wind attacks the surface or exterior of the body, the skin, where the defensive qi, or Wei qi, guards the body like an aura. As the lungs control the skin and the Wei qi goes through the lungs, the symptoms in this stage are related to the lungs. Symptoms of Wei level. Fever predominant, but there may be chills. Headache due to warm wind evil. Cough with thick and yellow sputum. Sore throat due to warm evil. Little or no sweating. There may be slight thirst. Tongue, red body, tip and sides, thin white or yellow coating. Pulse, floating and rapid. Treatment of Wei level. Formula, Yin Chiao San, honeysuckle and forsythia powder. Function, disperses wind heat, clears heat, and relieves toxicity. Qi level. At this stage, the warm evil has progressed into the interior. With the warm evil attacking the Zhangfu, excessive type symptoms, internal excess heat, will result as there is a confrontation between the vital qi, or Zheng qi of the human body and the pathogenic warm evil. Depending on which Zhangfu is attacked, resulting symptoms will vary. The most commonly affected organs are the lungs, stomach, large intestine, gallbladder, and the spleen. Symptoms of qi level. High fever. Profuse sweating. No chills with a sensitivity to heat rather than cold. Excessive thirst with a preference for cold drinks. Cough with yellow and sticky sputum, possible chest pain. Asthma due to lung qi deficiency. Patient will be irritable and uncomfortable in any position, constipation or apparent diarrhea, the stool will be dry due to the heat and unable to pass. Intestinal fluids appearing to be diarrhea may be passed. Stomachache, with fullness, tenderness, and discomfort with pressure. Tongue, red body with yellow, dry coating. Tongue coating could also be black due to stomach heat. Pulse, rapid. Excessive and deep indicating interior disease, or rapid and strong indicating a heat diseases. Notes, if the lungs are attacked, symptoms such as cough with yellow phlegm, asthma, chest pain will be present. With heat in the chest, irritability will be present. Heat in the stomach result in profuse sweating, with fever as well as a strong thirst for cold drink. Heat in large intestines result in constipation, abdominal ache, and diarrhea. Tongue coating could be black due to stomach heat. Treatment of Qi level. Formula, Ma Xin Shi Gan Tang, ephedra, apricot kernel, gypsum, and licorice decoction. Function, facilitates the flow of lung qi, clears heat, and calms wheezing by directing rebellious qi downward. Ying, nutritive, level. When the warm evil pathogen have progressed past the qi stage, it enters the nutritional qi, or yin qi stage. At this stage, the disease has nearly reached the blood, shui, stage, the deepest level. This stage is very similar to the Shuifen stage but is slightly less serious. Ying is considered the qi of blood and is also the precursor of blood. It circulates through the blood vessels and through the heart. This stage of a warm evil invasion, the most symptoms affect the heart, producing interior deficient heat. Symptoms of Ying level. High fever which is worse at night. Mental restlessness and insomnia, the heat has entered the Ying level and is progressing to the Shui, blood, level. Because blood belongs to the heart, the Shen is affected, producing mental restlessness and insomnia. Illogical speech, this indicates a further progression of the disturbance of Shen. As the disease worsens, the Shen dulls and eventually coma may result. Inability to drink more than small sips or a rinsing of mouth. This symptoms is due to stomach deficiency. Skin rash, red dots on a portion or all of the body, within the dots there is a small amount of blood. This symptoms is produced by the blood heat. Tongue, deep red body with a peeling yellow coat, the peeling is due to stomach qi deficiency. Treatment of Ying level. Formula, Qing Ying Tang. Function, cools heat, cools blood, and opens the orifices, clearing the Shen. Shui, blood, level. At this stage, the warm evil has entered into the blood. As the heart controls the blood and the liver stores the blood, both organs are affected at this stage. The kidneys are also involved. A significant symptoms of this stage is bleeding. The bleeding is due to heat in the blood, it may occur throughout the body. The skin may bleed, the mouth, nose, anus, etc. This stage is considered the final stage and is usually the terminal stage of a febrile disease. At this stage, people usually die very quickly. Again, the symptoms are made up of two types, excess heat symptoms and deficient yin symptoms. Symptoms of Shui level. Includes all Ying level symptoms, plus the following, spasms and shaking due to internal liver wind. Bleeding, the heart cannot control the blood anymore resulting in various bleeding symptoms, nose bleeding, vomiting of blood, blood in the stools, irregular uterine bleeding, etc. Tongue, deep red, or purple body. Pulse, wiry and small, due to wind and deficiency. Treatment of Shui level. Formula, Shi Jiao Di Huang Tang. Function, clears heat, cools blood, extinguishes internal wind, and stops the bleeding. Differentiation of syndromes according to Sanjiao patterns. Upper Jiao damp heat. Upper Jiao damp heat is the early stage of a damp evil invasion. In this stage the damp evil attacks both the lungs and the skin. Dampness can also affect the stomach and spleen at this stage. At this stage there is not much heat, mostly damp. However, if allowed to progress, heat symptoms will appear. Symptoms of Upper Jiao stage. Mucus discharge, inflammation. Diarrhea, 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 Yellow nasal discharge. Discharge and inflammation of the eyes. Discharge and inflammation of the ears. Lungs. Cough with thick yellow mucus. Swollen lymph glands on the neck. Fever. Slight fever, no fever, or afternoon fever. There may be chills or sensitivity to cold. Headache accompanied with a sensation of heaviness. Nasal and sinus congestion. Tongue, white coat. Pulse, fast. Treatment of upper jiao san jiao. Formula, huo xiang zheng qi san. Function, releases the exterior, transforms dampness, regulates qi, and harmonizes the middle jiao. Middle jiao damp heat. At this stage of san jiao damp heat invasion, the middle jiao is attacked. The spleen is easily weakened by dampness, and so at this stage the spleen's function of transformation and transportation is injured. Because of the relationship between the spleen and the stomach's function of receiving food and water is also impaired. The spleen is also responsible for keeping the muscles and limbs nourished, so there may be muscle tenderness and heaviness of the limbs at this stage. Symptoms of middle jiao san jiao stage. Abdominal discomfort. Bloating, gas, indigestion, loss of appetite. Vomiting and nausea. Diarrhea. With possible white mucus. Jaundice. On skin and eyes, especially if damp heat is strong. The facial complexion may be a dirty dark yellow. Fever. May be slight, afternoon fever, or may be reduced after diaphoresis, sweating, but then increases again. Heaviness of the limbs. Dry mouth. With no desire drink. Decreased shen. Fatigue or no energy. Urination. Frequent with burning sensation, tongue, gray, white, or yellow coating. Pulse, soft, slow, and may be slippery. Treatment of middle jiao san jiao stage. Formula, san ren tang. Function, remove heat evil and resolve dampness. If this stage of damp heat is allowed to progress, the following may occur. 1. The dampness may dry out and the disease becomes warm heat qi fen stage, which is the same as the 4 stages qi fen stage. 2. The dampness may cool off and the disease becomes a cold damp disease. 3. The disease may progress into lower jiao damp heat disease. Lower jiao damp heat. This is the last stage of the san jiao differential diagnosis. Chiefly, the large intestines and urinary bladder are affected, so there will be problems with elimination. Symptoms of lower jiao san jiao stage. Diarrhea with foul odor, possibly with a burning sensation, due to large intestine damp heat. Urinary dysfunction. Similar to urinary tract infection. Burning sensation, scant dark yellow urine. Yellow vaginal discharge with a bad odor. Addition symptoms may include genital herpes, or pelvic inflammatory disease. Lower abdominal distension. Dizziness. The dampness may affect the clear qi from ascending. Tongue, gray, white and yellow greasy coating. Pulse, soft, rapid, slightly slippery. Treatment of lower jiao san jiao stage. Formula, fu ling pai tang. Function, dispels dampness through diuresis.